Do you ever take a pregnancy test and you think, is that positive? Am I seeing a line? What is going on? Because unless it's immaculate conception, there is some funny business. Hi, I'm your local OBGYN. I love women and let's talk about it. So when you take a pregnancy test, you're kind of like, you're betting on it being accurate. You are like putting all your money on those cards. And the reality is that it is not perfect. And some of it is based on what you do correctly or incorrectly. And some of it's going to be based on other medical interferences that can play out and actually skew the results. So when you look at a pregnancy test, especially if it's the one where you're looking for like a line or a plus or whatever the test says you're supposed to look for, you have to actually read it within the window of time that it says. You don't want to read it too early because you may not have given the test enough time for HCG, which is the hormonal result that binds to that paper and actually causes the chemical change. And you don't want to take too long to read it because even if you have no HCG present, which is a true marker of not being pregnant, if the urine hits a certain point and then evaporates, you can actually get an evaporative line, or you can actually get air kind of causing a different chemical reaction. And if you leave it like 10, 20 minutes or you look in the trash like half a day later, you might think, oh my God, I missed a real positive, but it may not actually be that. So there are other things that you need to do. Look at what the manufacturer says in the test. You also want to know, do you have any other medical complications that could be interfering with it? Sometimes there's antibodies that could be present in your system. Sometimes there's things with rheumatoid factor that can also screw up the reading. There's also the ability for you to make something that comes from your pituitary, which is a little gland in your brain called pituitary HCG, which can turn a blood test positive, but it won't make your urine positive. There's really not a lot in the way of medication interference, but for the most part, if you follow the manufacturer's results, you should follow up with a doctor's visit, get some blood results to make sure that everything is kind of running in the same direction and that you actually know if you're cooking somebody.